Now we are going to do some lower face rejuvenation and enhancement here. And you can see a lot of fine lines on Connie here. And that is what we are going to go after for these. She doesn't like these fine lines. Now we are going to come back later and give some botulinum toxin in her mentalis muscle and in other places here. But right now I'm just going to go ahead and do some of these fine lines. So I'm going to use a combination technique of, again, I'm using velour and Volbella here, as you're going to see. Some of these deeper lines I'm going to place velour, some of the other finer lines I'm going to place Volbella and kind of mix up these things all together. But what I'm going to do is I'm going to go crosshatch on these lines, and I'm also going to go fairly superficial. This is velour that we're using there. Again, it's flexible, it's softer than your usual Juvederm or Restylans for that. So kind of you're going to feel a little pinch right here, and I'm going to go ahead and aspirate. I'm in the right plane. I'm actually very superficial, which is where I want to be, and I'm going to go ahead and deliver some AAFE Safe Injection Perfection Technique. You can't talk about safety enough, and I'm just going to fan in a lot of different directions here just to get some of these little thicker lines that are here right there. Going to do the same thing. You can see some of that texture here, and then I'm going to go back with some velour and Comfortox needles, as you're going to see in just a minute. This, and then we're going to add some Volbella for some of these finer lines too. Going to come around to the other side, do the same thing where she's got a couple of deeper lines on this side right here. And I'm just going to move you this way just a little bit. You can see that here. These are all fine lines. You can feel a little pinch. And again, I'm going to go ahead and aspirate. And I know that I'm safe. Retrograde injections, not very much in any place. And this side did not need very much. We're going to go back and do some very fine work with this right there. That is looking very good. And now let me go back, and I am going to go ahead and use some Volbella on some of the finer lines. It's going to be a lot of little pinches here. And I'm going to start on this side right here. And you see, I'm going to be very superficial. I'm not going to be around any major arteries or veins or anything like that. I'm going very superficial. This technique has been called a lot, micro-droplet techniques for this. It's been called a lot of different things. You've got to be right under the epidermis because if you're only in the epidermis, it is not a very comfortable procedure here, but we're going to attack it. It's a little bit of a tedious procedure for sure. There's no question about that, but you can see the support that we're getting in some of these very fine lines that is really doing a great job in all of this. Comfortox needles are fantastic for placing really precise filler just like this, as you can see. And again, I want a very light filler. Volbella is perfect for this kind of a technique and this kind of a light filler here for that. I know some people use, and you can see these fine lines pretty much are all gone here. I'm going to go to the other side. I know a lot of people use some heavier fillers for this, and then when they're all done, I see a lot of lumpiness, and so do the patients. I'm going to turn you this way just a little bit, so now we can all see it. See some of these really fine lines here, and Comfortox syringe, this is what it's for. This is really good, very superficial. Got to make sure you're right at the most superficial dermis as you're doing this here, and this is going to give some support to all of this here. So that looks really, really good. And again, it's the hydration that's also going to bring to that. I'm going to do some of these fine lines, as you can see right here. It is a bunch of little pinches. I'm sorry, Connie. She's a great patient. As many of you know, you've seen a lot of her treatment. I'm out of this Comfortox syringe, so I'm going to another Comfortox syringe here, and I'm just going to work my way up. Just a few more will do the trick right here, so you can see that. These Comfortox syringes are literally magic for botulinum toxin and very precision dermal filler, as you can see here there as well. That looks really good. And now we are just going to go ahead and smooth a lot of this together. Let me just take a look, one final look, and I can see that. Let me go ahead and now give her some arnica, which is great. And again, we're going to go back and smooth all of these different areas here for that. And arnica is great because you can go ahead and this ointment, you can literally, I almost call it like, you know, giving your fingers x-ray vision, because you can really feel where all of that filler has gone and smoothed it together. It just gives you a very different feel. You should always use some kind of either Vaseline or Arnica, which is great, which is an anti-bruising agent, and that just feels good. You can feel where that filler is, and if there are any lumps, this is all fairly smooth. And that is looking really good. And as you can see, this looks, I'll kind of turn your face to the different cameras that we have. No lumpiness anywhere. This is all looking really, really good for that. A slight swelling here and there, but really no bruising, no lumpiness, and that's all going to mold together. I am going to kind of mold this just a little bit right here, but I don't, and these are all superficial, so that superficial placement is really what will help her go ahead and support that skin and these very, very fine lines here. So that is looking really good. How'd you do, Connie?
Great.
Yeah, she always does great. All right, that's it. Thanks for joining us. We'll talk to you all again soon.